Hey, welcome everybody. Welcome to our workshop 2. It was great. I would leave to have seen you in the interactive component. We look forward to that. So in this workshop, what we really want to focus on is really helping you train health professionals to recognize what is really their role in helping fight human trafficking.
So we invite you to turn to your digital workbook and consider the following questions as we go through this workshop. What indicators have you and your learners encountered with a trafficked individual? How do you teach your learners to recognize barriers that prevent clinicians from identifying potential victims of trafficking? And what is one thing about this content that you want to incorporate into your own training?
I think that's great. Similar to what we said earlier, we want to highlight for you some key things that are important to teach your learners. So in this workshop, we want to be able to help you teach on how to recognize possible indicators of trafficking, to describe potential barriers to identifying individuals who've been trafficked, and to assess and identify individuals who may be trafficked. So those are the things that we want you to be able to know how to teach health professionals. So, honey, I'm curious, if you ask the average health professional, what is their role in human trafficking, what do you think they would say?
I have an answer for you.
Can you explain?
Yes, let me explain. So in all seriousness, there's so much burnout today, whether we're talking about physicians or other types of clinicians like nurses. And so the first step in thinking about oh, this is your role in trafficking and how am I going to train you in that, is to really understand where those clinicians are coming from.
Yeah.
And that they may feel like this is just one other thing you're asking them to do when they're just up to here. So understanding their context is really important. They're adult learners too, but you can provide them with practical tools about what their role is, and that's much more empowering.
Yeah, I think that's a really great point. So, I think recognizing and really acknowledging where your learner is coming from or where the health professional is coming from can really be a tool, like Hani said, to really help empower them and to help them recognize that there is actually a role that they can play in helping fight human trafficking. And, essentially there's really 3 ways that health professionals can help with human trafficking. The first is to really be able to recognize and identify signs of trafficking and respond appropriately, right? Like the eye can't see what the mind doesn't know. So giving them knowledge about that is really important. And then, the second is to really be able to train them to develop protocols in their work settings and in their professions so that their institutions can be better prepared to respond to trafficking. And lastly, I think it's really important to train and educate others. And this is exactly what you guys are doing. You're here to kind of sharpen already what you're doing so that you can go out and make more armies of trainers in human trafficking. So those are, I think, the 3 main ways that we can really help health professionals.
And some of them will resonate with one of those roles.
Right, exactly. And I think, along that line, when we think about training health professionals, it's really important to highlight vulnerable populations. But really, oftentimes there are some vulnerable populations that health professionals may not automatically think about. As a psychiatrist, I work with patients that I think are at great risk to be exploited in the trafficking world. So, my patients have mental illness, whether it's schizophrenia or intellectual disabilities that are that can be exploited into labor trafficking and sex trafficking. And oftentimes, I don't think health professionals think of disabilities as a risk factor for trafficking. They may think of it as a risk factor for other things, but not necessarily trafficking, which is, I think, important to point out to them.
So true. And we'll make sure we include in the resources some of the studies that have really borne out the link between disabilities, including mental health disorders, and vulnerability to trafficking.
Yeah, I think that's really great. Another thing that I think is important to point out to health professionals in this context is some of the counter examples, like, LGBTQ are also individuals that are at high risk for being trafficked. And that's good to point those things out that they may not intuitively think about. So this leads us to the second section of SOAR, which is observe. This is really recognizing the verbal and nonverbal indicators of trafficking. So Hani, I think I have a really great idea. I think that what would be really great is to train our trainers, to train health professionals to really memorize all the list of red flags that are there. And that way they have them in their memory bank when they're encountering patients. And what do you think about that idea?
This is what I think of that idea.
Oh, interesting. Why?
So, you know, Rahel, there's two reasons. One is just memorizing a list is not an effective way to remember things. And the other thing is that list is never going to be comprehensive. And so if a traffic person, we talk about the diversity of experiences that traffic people have.
Yeah.
What if they come to a healthcare setting with something that's not on that list? They're going to be missed.
That's really good.
I think. And actually the International Organization for Migration agrees with me, because this is their side, or derived from their side. That teaching health professionals how to think about the patterns that of health indicators as well as contextual clues is much more important in training them to identify potentially trafficked persons than it is to give them like this exhaustive laundry list. And even, you may be surprised or not surprised, but even within this framework, I have another framework too. So it's all a framework. Yeah,
I love it.
But it's that scaffolding in their brain to like really have a logic model to think about, okay, you know, is this person experiencing exploitation or not? So on the next slide, I'm going to go over my framework for health indicators, but on the contextual side of things, there may be clues like they're coming from an industry that's, we know it has lots of trafficking in it. They may be accompanied by somebody. They may not know how they got from where they work to the hospital. There's a lawyer that I work with in Michigan says that like all the traffic people she worked with know they can tell you their address. They have no idea how they got from where they are to
That's
you.
Interesting.
But the framework that I like for health outcomes is this one. So thinking about what they're exposed to as in the work that they're doing or where they're living, and then what are the health outcomes that can come from that. So, you know, in agriculture, it could be pesticide exposure, heat stroke. The case of Juan Carlos, the patient who was trafficked, there's a San Antonio Express article, experienced that, and that's what brought him to an emergency department. Or a construction worker maybe is living with like 40 other people in a small space. He might have tuberculosis. So those are some of the health, that's a way of thinking about what could cause those health indicators. Or maybe that same construction worker has threats against his family and now he wants to kill himself. He's suicidal. So that's an example of a mental health consequence. So frameworks within frameworks, but like giving them scaffolding and logic to think through.
That's really good. And I think, you know, another thing to think about is like, why is it that health professionals that may even know signs of trafficking still don't recognize when it's in front of their eyes? And I think part of it could be biases or barriers for their recognition. And we have, you know, patient or client related barriers, and we also have provider related barriers. And I think what's important in teaching this concept is that oftentimes health professionals want to focus on the patient and client related barriers, you know, whether it's like that victims don't naturally or normally identify themselves as victims, or they may not even know or use the term human trafficking, or whether, you know, victims are afraid of law enforcement, but also healthcare professionals. There's been data that shows that, you know, victims of trafficking have had poor encounters with healthcare professionals. But I think what's really important for us to highlight is the provider related barriers. What are the prejudices and biases that is preventing providers from recognizing these signs that are before them?
That's, Rahel, that's a really delicate topic, but I'm really glad you brought it up, because I absolutely agree that they might have have every single, you know, sign that they're being trafficked, that these biases can get in the way.
So, I mean, I guess, are you saying that doctors can be human too?
Well, I mean, I wouldn't go that far. But no, exactly. And many of them have, depending on when they entered into healthcare, not just doctors, may not have had training on bias as part of their education. And moreover, they may not have had training on the discrimination that people of color experience in our healthcare setting.
That's very true.
And so this is something that I think is really important for you to at least be aware of. You can decide how much you want to delve into the topic depending on the time that you have, et cetera. But most health professionals are not aware that there are just inequities in health outcomes when it comes to people of color in our health system. And it's just, it's crazy, the statistics. Like, if you're a pregnant woman and you're a person of color, even if you're rich, you're more likely to die in childbirth.
Yeah.
It's crazy. And that's the United States.
Yeah,
Yeah.
that's really, I mean, that's really something important that health professionals are really not aware of at all.
Yeah. And so just imagine if you're a person of color entering healthcare, you're probably on edge. Like, you're probably worried that you're not going to get the same treatment, you know? You know, I chose this slide because I had to narrow it down, but there are so many cognitive biases.
Yeah.
Not only that, you know, humans have, but then, like, you know, health professionals also have.
Well, let me just remind you, we are human.
So I just wanted to highlight a couple of these biases here for your audiences, and each of these can be a double-edged sword. So really, you need to be aware of them, and also you can use them to your advantage in educating health professionals. So talking through these, confirmation bias. So if a health professional is only seeing in the media that trafficking is sex trafficking, female, white, cisgender, they're more likely to just see that kind of trafficking, as opposed to, and they also might have a blind spot bias. They may not realize they even have that bias. And then on the anchoring bias, the bias number 1, this is one that you can really use to your advantage, where when you hear about something first, it like really sticks deep in your brain. And that's because of this primacy effect. So if you hear something first, for example, like, you know what I do, Rahel?
Yeah, what do you do, honey?
When I've actually switched saying, I used to say sex and labor trafficking, and now I say labor and sex trafficking.
So labor and
first.
sex.
Yes, I put labor first, just to kind of put that front and foremost when I'm in conversation with people about trafficking.
And also, you kind of anchor it then, right?
Exactly.
Yeah.
So
the
it's
first
like,
thing that they hear. So you do like a double Jedi moves.
Yes, double Jedi, using the bias to your advantage to educate health professionals. Yes. So the eye cannot see what the mind does not know, for sure.
Yeah.
And you know, Rahel, I love data, so I have to talk about this study, because I was wondering, like, does anything work to help overcome bias in the healthcare setting for health professionals? I mean, and what I found was this study that if you use simulation, so that's like kind of like role play, where somebody's actually imagining they're, you know, seeing a patient, but it's just an actor. And in that simulation, you use what are called counter stereotypical exemplars.
Okay.
You can change their behavior. That's what the study says. But what do you think counter stereotypical exemplars means? I mean, that's like a big word.
I don't know. Can you explain?
Well, I'm asking you. No. So it is, if you break it down, it makes sense. So like so it's basically the opposite of what they're already thinking about a thing.
Right. So,
you know, in this picture, we see these runaway and homeless youth who are actually forced to sell drugs. And that's something that most health professionals may have not have heard about, and they don't look like they're female identifying. So it really kind of defies my thought that this is a
opposite of the typical view that they see.
Yeah. So if I share how that maybe the guy in the middle with the hoodie, maybe I talk about how he was he was forced to sell drugs, and he was beaten if he tried to like leave that situation. That would help to open their eyes. Like if I started off with that and then we did a simulation, that would be really effective.
Yeah, that's really great. I think that's a really great tool to use to kind of break down biases. And I think just kind of along that line, you know, there's a lot of also like preconception biases that most healthcare professionals have, and who they imagine may be a trafficker, in the same way that they may have the white cisgendered female as a human trafficking victim. You know, oftentimes they may have this stereotypical view that a trafficker is this white or this, you know, overbearing male person. And so in that way can kind of have these blind spots and miss potential victims, because the reality is that it's not stranger danger, right? It's what the data has shown actually is that most victims of trafficking are known by their traffickers. So it's either family members or friends. And in fact, in the story that I shared earlier in the workshop, my patient that was forced into labor trafficking that was initially smuggled, she was actually smuggled by a friend, like a family friend. They were close. They knew each other for many years. But once she came here, they really forced her into labor. So there's actually new data that shows that women are 4 times as likely to be recruited for trafficking by their intimate partners, and that children are more likely than adults to be recruited into trafficking by their family members.
Wow, those are astounding statistics.
Yeah, I mean, I'm always amazed by that.
Yeah, and you hear during these COVID times like concern about kids being trafficked from people that they meet online, but really, not that that's not happening, but what we should be thinking about is also their family members potentially trafficking them.
Yeah, I mean, especially now because there's a lot of economic strain and financial strain where families might be desperate and might actually put their kids at greater risk for being exploited. And that's something to really be aware of and recognize.
Totally.
So this leads us to back to the SOAR framework, the ask component of it, which is really being able to assess and identify individuals who may have been trafficked. So I'm kind of curious, like how do you screen for people that may be trafficked?
Rahel, as much as I love your questions, I hate that question when people ask me.
Why?
It's because people get so focused on screening and checklists, and we actually have heard from survivors that when they come to healthcare, they already feel super checklisted, right? They feel like people are just checking boxes and not seeing them as a person and not even really like talking to them. And so, yes, we need to ask our patients questions, but it's got to be in the context of a larger conversation. And so, I think the right question to be asking is like, how do you create those conditions to empower that person, as opposed to, how do we use checklist? Yeah.
Well, so then, I mean, I guess I'm curious then, like, what is your approach to assessing a victim of human trafficking? How do you approach that?
Well, that's a good question. I really like to start with thinking first about like what the goal is. And
so the goal, I mean, is obvious, like you rescue them. I mean, you don't want them in that kind of situation. That's why we help professionals, right? To rescue.
I mean, honestly, like that's what we hear so much, right? Like when we're training other health professionals on trafficking, right? I'm sure Patrick's experienced that when he's trained people on trafficking. Is like, we got to rescue. But what we know is that whenever we try to rescue somebody, we're actually taking power and control away from them. So the goal is not rescue. And is it okay if I like go meta for a second?
Meta all the way. Let's go meta.
The reason I have these slides with this picture is that Rahel, I was giving all of these trainings for health professionals, and then at the end, I like, despite saying, don't rescue, guess what they asked me? They were like, people raise their hand.
How do we rescue?
Yeah. And I was like, are they just not hearing it? And it was just, it's such a deep instinct.
It's like ingrained in.
Totally ingrained. Yeah. It's like one of those grooves you got to like overcome. So pictures are really, really powerful. I stopped getting that question once I started using the slides. So,
yeah, it's kind of like a picture paints 1,000 words.
Totally. Yeah. And speaking of which,
so,
we've talked about what the goal is not, and what the goal is actually to create that open door, that individual feels more empowered and more safe as a result of that experience in healthcare. And this is something I've heard time and time again from survivors where, you don't know whether your interaction with them is like the first interaction with a caring individual that's planting a seed, or if it's the 99th out of 100 and then they just needed 100 interactions and then they were going to leave that situation. But you're building their resilience. And
you're building that trust. Yeah, that's really good. Like I've heard a lot of great things about the PAIR tool. Can you kind of explain that to me?
And it just got released in Spanish too. I'm really excited.
Mucho bueno.
I love pears. What's your favorite?
Oh
fruit?
man, I love peaches and mangoes.
Those are good ones too. Now I'm like totally hungry.
Yeah.
I wonder what Rashid's favorite fruit is.
I don't know, but or Rebecca's, like, can I guess? Maybe apples? I have no idea.
All right, we'll let them share.
Okay.
But in all seriousness, I love this tool. It's based on evidence from that when we learned from domestic violence, and it was created in collaboration with survivors, including from Dignity Health, Heal Trafficking, the Pacific Survivor Center. And the steps to this is the approach that I was talking about, where you're creating those conditions that are empowering. So the steps are provide privacy, educate, ask, respect, and respond. And it's not just specific for trafficking. It's really kind of a catch-all for other forms of violence too. But Rahel, I was wondering, like, let's say somebody comes to your clinic with their auntie and you're like, there's some alarm bells going off. You're like, I'm a little bit worried the person might be trafficked. Like, I want to have a conversation. Like, how do you talk to them alone?
Yeah, I mean, that's a really great question, and I think that's something we really want to hone in when we're training health professionals. It's that, it's not something that you're thinking actively about while you're doing the interview. You don't want to alert the trafficker. That's going to be a greater risk for the potential victim, right? And you don't want the trafficker to be suspicious of anything. So you really have to come up with a plan, like a separation protocol type of plan ahead of time, so you're not like doing it in the middle and kind of fumbling your way through. So, I think for me, for example, like if a patient came into my office and there were some signs that I was kind of cautious about, in a way to do it without alerting the potential traffickers, for example, you can ask them, there's some forms and things that need to be filled out. Can you kind of step out to help complete that while I do a physical exam or something like that, so they're not really alerted to anything, and then you can proceed with your assessment. Or if you're like in the ED and the auntie doesn't want to leave, one of the ways to do it is say, like, you need to get a urine sample, and we take the patient to the bathroom, and that way they're not really thinking about it. Or you need to get or like you need to get an X-ray, and so you're going to take them to the X-ray, and while they're going there, then you can conduct your assessment. So it has to be thought through, and
use your team,
you have to use your team. Yeah. You collaborate. Like we said, we're not lone rangers in this, and so I think that's one of the ways that I would think about doing that.
Great, thanks for sharing those strategies. So we wanted to just do a quick role play. We talked about simulation earlier.
Yeah, so as we do this role play, it's kind of like an example of simulation. We really want to highlight then the last three components of educate, ask, respond, and respect, and how we can do that in a real setting.
And you totally customize this to your patient, and
exactly.
Or have your learners customize it to their patients, and encourage them to practice, especially when they have a low suspicion, so they get comfortable. So Rahel, what kind of patient are you here?
So I'm here with a skin infection. I use heroin, and I got a skin infection as a result of that, and have come to the ED. And so this is my doctor that's treated me.
Okay. Hey, Rahel, I'm really glad that we were able to treat your skin infection. I know we're just about to discharge you, and I just wanted to talk about something important. And that is that, I'm actually been, I'm working in the emergency department, and in this community, we've noticed that a number of people who use drugs have to exchange sex in order to pay for their drugs. And sometimes they meet the wrong drug dealer who actually starts just like controlling all of their life. Where they come and go, threatening them, and they really feel like they can't leave that situation. And we have resources to help people like that. So I just wanted to let you know that, and also to ask, like, is that something that's happened to anybody you know or to you?
Oh, so you're familiar with that kind of situations?
Yeah.
Okay. Yeah, no, I'm totally fine. I'm good.
Well, know that if that answer ever changes, we're here. It's the emergency department, so we're 24/7.
Okay, thanks. All right.
Cut.
Yeah.
So that may have seemed like, I didn't rescue her, right? Like, so it might not have felt fulfilling, but the reality is that that was a successful interaction, right? I built rapport, and
you planted the
seeds and provided education, and I respected you ultimately. So exactly. I didn't push when she wasn't in the place to push.
And she asked and opened the door. And I think what's also really important is that now that individual knows that this institution, this hospital could be a safe place for them to come. So It's really great. So as we finish up our second workshop, thank you for being with us. We want to leave you with two things. Think about from the video, what things you want to incorporate in your future training.
And I'm really curious to hear what Kasha and Maya have to say.
I know.
What are they going to incorporate?
Yeah, I don't know. Or Nathan. Yeah, I'm not really sure. Yeah, that'll be cool to find out. Okay. Thanks, guys.
Bye.
Bye.